Hey everyone, it's great to be here with you today. I want to send a big thank you to the New Settlement Community Center, the League of United Latino American Citizens, and Columbia University of New York for hosting this presentation today. My name is Patrice Robinson, and I'm with the National Institutes of Health and the All of Us Research Program. And I would like to thank you for joining us today to learn more about how you can become a participant in the All of Us Research Program. But before we get started, I'd like to go over a quick slide with you, as well as formally introduce myself. So before we begin our discussion today, we would like to take a moment to familiarize you with some words and concepts you will hear a lot about in this presentation. These terms are central to the All of Us Research Program, as they each represent a key component of what the program does and how it is achieved. You'll be hearing today about the role each of these play in the program in advancing precision medicine. Understanding the program's use of these terms will also help you determine the best way you may want to be involved and how to participate. So once again, my name is Patrice, and I joined this initiative because it gives me the opportunity to help my family and future generations. As someone with friends and family personally affected by cancer, high blood pressure, and diabetes, I recognize the importance of diversity and better healthcare and prevention for our communities. And that is why sharing this information today is very important to us, because we all have the power to make a change. So you may be asking, what is All of Us? All of Us is a large program led by the National Institutes of Health that is working to improve care through research. Unlike research studies that focus on one disease or specific group of people, All of Us is building a diverse data set that can inform thousands of studies on a variety of health conditions. It is a longitudinal effort, meaning we hope will last at least 10 years or more, and we are over halfway there, and we will be celebrating 6 years this May. To gather data from at least 1 million people who reflect the diversity of the United States, in order to accelerate health research and medical breakthroughs to enable individualized prevention, treatment, and care for all of us. So, did you know that according to the National Institutes of Health, who is leading this program, only 10% of the population is included in health research, which is part of the reason we are here today. So each person is different. Our habits, our environments, and our biology, and the interaction of these factors greatly impacts our health. But when we visit the doctor, our treatments are usually a one-size-fits-all approach. To provide healthcare that meets everyone's needs, we need precision medicine. Precision medicine focuses on treating a person's specific healthcare needs. In order to understand everyone's healthcare needs, scientific experts need health data from as many people as possible. It acknowledges that a one-size-fits-all approach to medicine isn't the best, because we know what works for me to treat me may not work to help to treat you. Precision medicine is a radical shift in how each of us can receive the best care possible based on our unique makeup. If you're joining this session, you may be curious about what the program is and why New Settlement Community Center is bringing this opportunity to those they serve in your neighborhood. Up next, we will cover the enrollment process and what type of information you could receive as a participant, the partners involved, and why your contribution truly can make a difference. So how can you make a difference, you may be asking? Well, for example, did you know the Bronx, New York, as a community, suffers from hypertension across ethnicity and races? Did you also know that as of today, the All of Us Research Program has 81 research studies that want to answer questions about why people have hypertension? Is it something genetic, environmental, or is it based on their lifestyles? An example of one of those research studies is by Yvonne Commodore Messiah, who is an early career tenure track researcher at Johns Hopkins University, titled Social Determinants of Hypertension. The study aims to understand the social determinants of health that are associated with hypertension among United States adults. This research question is important because hypertension is a major public health problem in the US. Despite the availability of affordable medications available to improve blood pressure control, significant progress has not been made. Prior studies have shown that there are disparities in hypertension, prevalence, treatment, and control. We would like to explore the question further to understand how social determinants contribute to the burden of hypertension in the US. If you join our database, you and who you are can help answer this question. You are that powerful. This chat is open throughout the presentation for any questions that you may have. Please use the feature and we will address and answer any questions at the end. And remember, the All of Us research program takes your privacy and security very seriously. So avoid sharing any personal information during today's presentation and respect the privacy of others. So there are many ways that you can join. These include online via our website or our mobile app. You can join in person at a local healthcare provider network, also known as a HPO, or we have a national tour called the All of Us Journey that is traveling the United States. You can also join via mail. Our salivary kit is available nationwide and to all US territories. And remember, your organization will send you additional information that is specific to you and your enrollment options. So once you're on the website and you've downloaded the app, the very first step to join the program is to create an account. You can either use your email address or mobile phone number to join, and you'll also need to set up a password, which must be at least 8 characters long. Creating your account is just that simple. So next, if you're using a web browser, upon login, you will see a welcome prompt with an orange button that says, "I'm ready." This is one of the most important parts of the enrollment journey. I love the consent portion because the consent goes over exactly what you can expect. If you choose to take part in this exciting research program, and keep in mind, if you would like to participate in the All of Us research program, you will need to consent. The consent process may take you between 15 to 30 minutes to do so. Throughout the participant portal, participants can share and receive information. So let me do a quick walkthrough on what that will look like. When you log in through a web browser, you will see a participant dashboard. As a reminder, your name and other information that can identify you will be removed and replaced with a code. You will have a unique participant ID. This will help keep your information confidential. You will see 3 menu options: Dashboard, My Data, and Settings. We encourage you to first go to your settings and set up your preferences, and there you can refresh your account information if needed, set up notifications and language preferences so that you can always stay informed, have access to your support team that will be glad to help you with any questions you may have, and share information about the program with family and friends. If you decide to log in through the All of Us Research mobile app, you will immediately be prompted to consent and then go to your profile settings. You'll then see the main dashboard with 3 menu options at the bottom. So sharing your data. After completing this step, you'll be able to start sharing your health information with the program. This is the information that will help researchers find new things, and who wouldn't want to be a part of that? If you decide to join, you'll be asked to answer some basic questions about yourself. So your health history, family, home, and work. This information helps researchers learn whether things that affect health are the same or different for groups of people. The surveys will take about 30 to 60 minutes to complete, and you can choose not to respond to any questions that you're not sure about or would rather not answer. This information, the All of Us research program, will last over 10 years, like I said before, and hopefully more. So we may also ask you follow-up questions from time to time. We are never the same people twice, so updating our information helps. Again, all this can be done online, either on your mobile app or through your participant portal. So the first survey you will complete is called the basic survey. Once you complete this, you will be asked to share your electronic health records. An electronic health record, also known as EHR, is a digital version of your medical chart, and it may contain sensitive data. If you decide to share your health records with the program, researchers will be able to see information about your health conditions, test results, medical procedures, images like your x-rays, and medicines that you take. All of us will use state-of-the-art technologies and processes to protect the information you share, as we understand the importance of your privacy. You may also consent to receive information about your DNA if you complete some additional steps, which we will discuss in a few minutes. Participation in the program is voluntary, and you can decide yes or no. It is absolutely your choice. The All of Us research program wants to help researchers better understand how different factors, including our genetics, make our participants unique. To do this, the program may ask for your blood, your urine, or your saliva samples. These samples are very helpful to researchers as they provide a wealth of insights. Providing a sample, like all aspects of the All of Us, is voluntary. If you choose to share your samples, they'll be sent and stored at the All of Us Biobank at the Mayo Clinic in Minnesota. The biobank securely stores participant samples that the program has collected thus far until they are used by researchers. One of the many reasons I joined the program is because my samples will be added to the All of Us database, allowing researchers both nationally and internationally to learn more about how to improve healthcare for all. So, depending on your region of the country, you may have different options, including ordering a saliva collection kit or ordering a kit to bring to a local Quest Diagnostics Center, or visiting an enrollment site or the mobile All of Us journey if they are visiting a city near you. We have upcoming stops in Charlotte, North Carolina, Richmond, Virginia, and Shreveport, Louisiana. To view additional upcoming stops for the journey in 2023, please visit the All of Us Journey website, which we are dropping into the chat. The saliva collection kit is meant to help you provide samples if you do not have an All of Us partner site in your area. We have over 100 partners across the nation, but there is no guarantee that a site may be conveniently located close to you. If you're in an eligible area, collection is simple. After completing the necessary steps in the participant journey, you'll know if you're in an eligible area if you're offered the opportunity to provide a saliva sample while you're logged into your account. Now, another way to provide samples is by participating in the Bring Your Own Kit program with Quest Diagnostics, one of our program lab partners. To order your BioBox, you will need to log into your participant portal, select the Share Your Bio Samples dashboard, follow the steps to enter the shipping address, and schedule the appointment. The BioBox will arrive at your mailing address you provided within 7 to 10 days. An important note if you select this option is please do not open your BioBox before your appointment. So, okay, a little pop quiz. What two options do you have to provide biosamples? Type it into the chat. Well, to provide samples, type it into the chat. Let's see if we have some answers. Okay, so we have okay, great job, May, thank you. So, okay, good, you're still with us and we didn't lose you. So saliva collection kit would be one of the answers. Your Bring Your Own Kit program with Quest Diagnostics will be another answer. And you get bonus points if you said the enrollment site or the All of Us journey. So earlier I mentioned that your consent is necessary to receive information about your DNA. You can decide yes or no. It is absolutely your choice. You must complete this consent before we invite you to schedule an appointment to provide blood, urine, or a saliva sample. However, you do not have to answer yes to the consent or provide a sample in order to participate in All of Us. If you say no, or I'm not sure right now, you can still participate in the program. Some methods of checking for DNA results take longer than others, and a lot of factors affect the timing of when we can analyze your DNA for research. Once we're ready to generate DNA results reports for you, we will contact you through your participant portal. You will see some information about the specific type of DNA results we are ready to check for. You can then decide if you want those results. If you decide yes, you will get access to a report on that type of DNA result when it's ready. And if you decide no, you will not get that type of DNA result. Because there are different ways to check for different types of DNA results, you can expect to get multiple messages over time. Please check your All of Us account regularly for updates. If you need help understanding what the results mean, you can contact our genetic counseling resource, also known as GCR, for free. You can schedule an appointment online through your All of Us account. You can also contact the All of Us Support Center, and they can set up an appointment for you. Additionally, you can view educational materials through the All of Us participant portal that can help you better understand your results. So let's pause right here for a minute and summarize what we've learned so far. The enrollment journey consists of setting up an account, completing consent, sharing your electronic health records should you wish to do so, completing surveys, and providing samples through one of the enrollment options as we discussed, again, if you wish to do so. And remember, the eligibility for these options is determined by many factors, and not all participants may have access to all enrollment options we shared with you today. If you would like to learn more about other sample donation options, please call our helpline at 844-842-2855, or you can also email help@joinallofus.org. We will drop both contacts into the chat for easy access as well. So the All of Us research program is dedicated to better health, both in the future and today. By participating in the program, you may help future generations. You will fuel health research so we can identify new breakthroughs. By looking for patterns, researchers may learn more about what affects people's health. You will also learn more about your own health. And lastly, by participating in the program, you can help advance COVID-19 research. And that is why having a voice in health research and participating is so important. All of Us aims to engage a community of participants that reflects the diversity of America, including many people who haven't taken part in medical research before. By joining the program, you are helping researchers to learn more about different diseases and treatments. And remember, there is no one exactly like you. So my why for joining the program is really simple: my family. If I can take a part and find a solution to some of the diseases in my family and my community, I'm willing to lend a helping hand. So you guys have been amazing, and I really, really appreciate you sharing your time with us. And I know we've shared a lot of information, important information. So if we have any questions, this will be a great time for you to ask them, or I will also check the chat. Do you have to be, let me make sure I don't have any other ones before I answer that one. Okay, so do you have to be a legal resident to participate? We will never ask you a question if you are a legal resident. You just have to live in the United States. Do we have any other questions? How old do you need to be to participate? So you have to be at least 18 years old to participate in the program. Are there any fees associated with the research? On your part, there are no fees. Everything is absolutely free for any participant. Can I go to New Settlement and sign up in person? So that is a great question. I will refer that to May. She may be able to help me with that one. I do know there are HPOs and things in your area in Bronx, New York, but I'm not 100% sure if you can sign up at New Settlement. Oh, yes, I'm sorry. Yes, they will have an event on April 13th, and you can sign up there for that particular event that will be at New Settlement. Can I bring my senior parents? Yes, of course. We're asking you to bring your friends, your family. Your parents will just have to be able to consent and do everything on their own. But definitely, we want you to come, your friends, and your family. And there any more questions? April. And do you have bilingual staff? Yes, definitely. We have bilingual staff that will be able to assist anytime we have any type of event. So definitely, we do. And once again, before we close out, I want to reiterate that a New Settlement is having an in-person event on April 13th. And that way you can get a lot more information, and you can also sign up on that day as well. Okay. You're so welcome. Thank you guys for participating and being here for the presentation. Okay, so you can also visit our website at bit.ly/LULAC_PMT, where you continue to learn more. And we'd like to thank you all for your time, and we hope you enjoyed learning more about the All of Us Research Program and the enrollment journey. All of Us is delivering one of the largest, richest biomedical data sets that is broadly available and secure. Together, we can make a difference in speeding up research and improving the health of our communities. Have a wonderful day. Goodbye.